What is 100% total capsulectomy? Nice patient from the Midwest. 100% total capsulectomy, 12/3/25 initial AL. As you can see, I removed the excess skin at the bottom to help with the contouring. She had what was a lollipop anchor incision on the right side, and so you can see a very thin flap. A lot of tatty tissue on the side removed, but this was a very thin attenuated flap excess skin that I removed. And as you will see, this is the excess skin removed. That was the implant was working as a tissue expander, and the entirety of the implant capsule has been removed. And now I'm going to go ahead and remove the capsular tissue. She has had a total of 3 surgeries: 2003, 2012, when she had her silicone implants, 500 cc's on the right, 550 on the left. The left one was noted to be ruptured in 2014 when she had her last reconstruction, which is very interesting. In just 2 years, the 2012 implant on the left side was ruptured. So I'm going to go ahead and basically cut this capsular tissue open, and complete 100% total capsulectomy has been done. And as you will see right now, intact implant, very much so intact, and the capsular tissue has been removed. Some fluid on the back that I'm going to go ahead and see, and you can see, look at that stickiness. That is consistent with the leaching of the silicone of this Allergan 500 cc implant, just like the op-note set. And you can see, look how thin the capsular tissue is. Complete removal of the entire implant capsule, all inflamed tissue has been achieved. And now what I'm going to do is I am going to go ahead and focus on the left side. And the left side, I am going to basically look at this attenuated thin skin. You can see she had what was an incision here at the bottom at the inframammary crease, and again this fatty tissue on the side for contouring. She had significant asymmetry, and overall I'm very happy and content with how the whole dissection has gone. Complete entire implant capsule removed. I have sterile pair of gloves underneath my top one. I'm going to use the fresh ones for the left side. And as you can see, a lot of redundant capsular tissue. All of it has been removed, especially in the upper part of the chest. That is as important to remove as the capsular tissue on the lower part. And as I go in, you can see how thin the capsular tissue is. Complete removal of this thin capsular tissue. You can see how transparent thin this is. If I show this ruler, you will see. You can actually hear our patient. She is waking up from her surgery. And as I go and show this, look at this leaching of that silicone from the silicone intact implant. This is your 550 Allergan, just like the op-note set. And as you will see, look at how thin this capsular tissue is, and some areas relatively thick, and complete removal. Now she had what was a rupture of the silicone on the left side, so all of this inflamed tissue that you see on the periphery has been removed. She had capsular contracture from her first set, second set, that has also been removed, and this is what you see, that thickened capsular tissue, so that one capsule grows on top of the other one. And so all of this has been removed completely, definitively, sincerely. So you can see the left one is much more involved than the right one, and it is also incorporating what is that tissue on the surface, on the periphery, such that all of it is incorporated with the implant and capsule. So that 100-100-0 rule certainly very much applies on the left. All bad inflamed tissue, implant capsule has been removed completely, sincerely, definitively, with only good, healthy, viable tissue remaining behind. So the implants will be returned to the patient, capsules to be sent to pathology, rule out that rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does post-op minus these implants. So there you have it. No need for the unnecessary drains, no need for the unnecessary lift. We'll see how she does overall from her many symptoms of what is breast implant illness. This is Dr. Khan, Executive Plastic Surgery.